Let me start with a question that usually makes a room go quiet. When was the last time a patient surprised you with how much they already knew? Not from a medical textbook. From lived experience. From tracking their own data. From thinking deeply about what kind of life they want. That moment tells us something important about where medicine is today. Picture this. A patient walks into your clinic informed, prepared, and ready to talk options. They are not asking you to decide for them. They are asking you to decide with them. This is not a challenge to clinical authority. It is an invitation to collaboration. And how we respond determines trust, adherence, and outcomes. Patient engagement is no longer a trend. It is the operating system of modern healthcare. Engaged patients are more likely to follow treatment plans, report symptoms earlier, and feel ownership over their health. Personalized care is not about offering more choices. It is about aligning care with what matters most to the person sitting in front of you. That alignment is where outcomes change. Let me share a real clinical moment. A patient once told me, "I am not afraid of the diagnosis. I am afraid of losing control." That sentence reframed the entire visit. The treatment plan did not change dramatically. The conversation did. And that made all the difference. Personalized care begins with a mindset shift. From telling to partnering. From assuming to asking. From protocol-driven to person-centered. Shared decision-making is not about giving up expertise. It is about using expertise in a way that respects patient values, goals, and realities. Here is a simple structure that works in real practice. First, present more than one reasonable option. Second, explain benefits and risks in plain language. Third, ask what matters most to the patient's life, not just their condition. Fourth, decide together and document the reasoning. Finally, revisit the decision as circumstances evolve. This does not slow care. It strengthens it. Now, let's talk about communication. Today's patients are informed, connected, and health-conscious. They expect clarity, transparency, and partnership. They do not want more information. They want better understanding. Short sentences. Clear explanations. Space to ask questions. Listening is no longer a soft skill. It is a clinical competency. Of course, there are real pitfalls. Treating shared decision-making as a checkbox instead of a process. Relying too heavily on technology while underestimating human connection. Assuming health literacy based on confidence or digital fluency. These missteps erode trust quickly. Awareness is the first safeguard. Ethical and legal considerations are evolving alongside engagement. Informed consent now includes data use, personalization, and predictive insights. Patients deserve transparency about how decisions are supported and how their information is used. Equity matters here. Engagement strategies must be accessible, inclusive, and respectful of cultural and social differences. Innovation without trust is not progress. Here is the question I want you to sit with. Are we practicing medicine for patients? Or with patients? That single distinction defines the future of care. If this resonates with you, I invite you to do 3 things. Reflect on one recent patient interaction that could have gone deeper. Share a story with a colleague where listening changed the outcome. And start a conversation in your team about what engagement really looks like in your practice. Change does not begin with policy. It begins with awareness. Patient engagement and personalized care are not optional additions to medicine. They are professional imperatives. They elevate outcomes. They strengthen trust. They remind us why we entered this profession in the first place. Thank you for being part of this conversation. If this perspective sparked a new insight, a question, or even discomfort, that is a good sign. Growth often begins there. Let's continue moving beyond the diagnosis and toward care that truly centers the patient.